Hello, my name is Samantha Medrano, and my presentation is on equine colic. So what is colic? Colic is simply a medical term used for abdominal pain. It is often caused in the digestive tract and most commonly found in horses. There are many causes, some being parasites, but majority of the causes are not transmittable. Colic is not zoonotic. Some causes, such as tapeworms, are, but colic itself is not. As for geographic cases, since colic is so common and unpredictable, it happens all the time, no matter the place. It is also hard to prevent and can occur randomly. So, etiology. There are three main causes for colic, and they are treated very differently. The first colic we are going to talk about is gas colic, which is the simplest and most common type. It is due to excessive gas production in horses and can cause mild to moderate discomfort. Treatment is fairly easy. It can be resolved with medication or, if needed, a nasogastric tube. These are examples of nasogastric tube. As you can see, it is a tube that is inserted through the nasal cavity, down the esophagus into the stomach, and it is just to help relieve any buildup of gas or fluid. Etiology 2. Obstructive colic. In these cases, something is blocking the passage of digestive material through the tract. There are two types. Non-strangulating obstruction lesions is when a digestive material itself physically blocks the passage. The second type is strangulating obstructive lesions, and this is when the intestines actually twist or prevent the movement of the digestive content. For strangulating obstructive lesions, this will require emergency surgery in order to fix any twisted organs or remove any damaged organ. Etiology 3. Functional obstructions. This is when nothing's actually in the way of the digestive content, but something is causing the gut not to move as it should. Inflammation can be considered a functional obstruction for colic. Another is spasmodic colic, and this occurs when there are several contractions in the intestines. So pretty much getting a cramp in your intestines. Most can be managed medically, and if needed, the horse may need surgery. As for spasmodic colic, it should go away in about an hour or so. If not, antispasmodic medication will be needed. Tapeworms are something to be cautious about since they are the cause of 22% of spasmodic colic. In the image below, you will see a normal intestine, an irregular one, and then a spasm. These are some of the following symptoms of colic: an absence of gut sounds, pawing at the ground, stretching as if to urinate, frequently looking at their side, biting or kicking their flank or belly, laying down or rolling, little to no passing of manure, fecal balls smaller than usual, poor eating behavior, change in drinking behavior, or the heart rate being over 45 to 50 beats per minute. These are the more visible signs of colic, just to give you a more visible example. So, as I've said before, colic is extremely hard to prevent. There are prevention methods in order to prevent the causes of colic, but colic itself is hard to prevent. So some of the methods can be: do not make sudden changes to the horse's diet, check teeth frequently for dental problems that may cause chewing issues, provide adequate exercise, practice an efficient parasite control program that fits your farm's needs, provide clean and abundant fresh water at all times, feed on a regular schedule from day to day, do not feed moldy or spoiled grain or hay, provide adequate long stem roughage in the horse's diet, keep stalls and paddock areas free from foreign objects that the horse might ingest. Again, colic is very hard to prevent, so these prevention methods are just to keep your horse healthy. This is my worksite slide, and thank you for watching my video.